All righty now. Good morning, everyone, and welcome to City Hall. I am Kendra Brooks, Minority Leader and at-large member of City Council. Today, I'm proud to be launching Philadelphia's first ever Reproductive Freedom Task Force. Let's get some. When the Dobbs decision came down, we saw the rage and sorrow of a city that refused to have their autonomy and reproductive rights threatened. Our city marched in step with a diverse, broad movement and demanded a future defined not by shame and stigma, but by freedom. The freedom to control your body, your family, and the course of your life. My party, the Working Families Party, led a series of actions in the wake of the Dobbs decisions, where we shared stories speaking out against the illegitimate decision that stripped away our rights. We even shared our own stories. I shared my own story about my abortion. And through this process, I knew that we needed to take action to strengthen our local protections and to bring providers together to safeguard our city. And that's why we did everything in our power to protect our constituents, our healthcare providers, and everyone or anyone who chooses to travel to our city to receive reproductive care. Alongside Council members Jamie Gauthier and Helen Gim, I passed the first of its kind legislation to ensure that no matter who you are or where you work, your reproductive health care decisions cannot be used against you. Because freely accessing reproductive services is a cornerstone of quality health care, and health care is a human right. Regardless of the outcome of the presidential election, Philadelphia's families deserve access to safe, affordable reproductive health care. To me, reproductive freedom is more than just abortions. It's about the conditions that allow everyone to live, work, and raise children in healthy, safe environments. That's why I have been a staunch advocate for the survivors of domestic violence and have worked to expand protections of victims of coercive control in my first term. I look at these issues from a holistic perspective because we know women's health care centers often offer countless important services that families need. During my last campaign, I promised that the Working Family Party council members would champion reproductive freedom. Our Republican opponent said abortion is not a local issue. I disagree then, and I disagree now. When a single mom in Philadelphia can't afford an abortion, that's a local issue. When a young person is afraid to walk into a health clinic because an angry crowd is harassing patients outside, that's a local issue. When a middle school student stays home from school because she can't afford money for pads, that's a local issue. Reproductive freedom is a local issue, and today I'm making good on my promise. Throughout the last year, my office has worked with the Parker administration to set up Philadelphia's first Reproductive Freedom Task Force. This task force will work to ensure that Philadelphia's rights remain protected and that we are safeguarding our city from any future attacks by any politician who does not respect a woman's right to choose and access to the type of health care that she needs. In this budget, I advocated and won close to $1 million in direct funding for reproductive health care providers. Last year, advocates of Planned Parenthood of Southeastern Pennsylvania shared with my office that anti-abortion extremists, emboldened by the Dobbs decisions, were threatening the safety of patients and providers. They needed more funding for security and a coordination with city agencies. After that conversation, we won $500,000 in our most recent budget, first ever city funding towards Planned Parenthood. We also secured secured for funding for low-income women to access reproductive health care and for resources to end period poverty. By protecting our reproductive freedom, it is more than just funding. It's about listening to the women, the providers who have boots on the ground every day. It's about creating spaces where we can work together and respond to the emerging needs in real time. And it's about thinking ahead and anticipating the challenges and opportunities for what the next 4 years could bring. That is the work of the task force that we have brought together today. The task force is made up of patients, providers, city agencies, and stakeholders who will work together to ensure that we protect and increase access to abortion and reproductive health care here in Philadelphia. And I want to thank the mayor and her team for helping move this process forward. And I look forward to working together and alongside my council colleagues to implement recommendations for this task force as we put them forward. Next, I would like to welcome one of the members of the task force, Dr. Chioma Enubisi. Thank you so much, Doctor, for your taking time out of the day and sharing your expertise with us on the task force.
Good afternoon. My name is Dr. Chioma Enubisi. I'm a double board certified OBGYN and a complex family planning specialist here in Philadelphia. I'd like to start first by thanking Councilmember Kendra Brooks for this opportunity to serve on the Reproductive Freedom Task Force and also to speak with you all today. I want to take a moment to reflect on our recent history. Leading up to the 2016 presidential election, community advocates, healthcare providers, and countless others raised the alarm about the dangers we would face. If a federal administration hostile to sexual and reproductive health gained control of our judicial system, healthcare, and civil rights, we warned that access to contraception would decrease, federal protection for abortion Federal protection for abortion would be overturned, and the maternal health crisis would worsen, particularly among Black, Brown, Indigenous, and low-income communities. Sadly, as we stand here today, we've witnessed those warnings come true. The Supreme Court stripped away our federal protection for abortion, and the federal government drastically limited Title X funding for contraception. The devastating impact of these changes continue to unfold across our country. I see it firsthand in my practice. More and more, I care for patients traveling from as far as Texas and Florida, seeking the essential health care they can no longer access in their home states. Numerous studies have confirmed that abortion bans are linked to worse maternal and neonatal outcomes. One of the most heartbreaking examples is the death of Amber Nicole Thurman, a Black mother in Georgia, whose life was lost due to delayed care, delays directly caused by abortion restrictions. Here in Pennsylvania, I am relieved that abortion remains legal. I am deeply grateful for the critical protections provided by the Reproductive Freedom Platform, thanks to the leadership of council members like Kendra Brooks, Jamie Gaudier, and also former council member Helen Gem. Yet, even in our states, patients and providers such as myself still face barriers, including, but not limited to, stigmatizing state-mandated counseling, a 24-hour waiting period, and restrictions on funding for abortion care. I am hopeful that this Reproductive Freedom Task Force will lead to more than just a conversation. I hope that it sparks real, transformative action. We must continue to fight for Medicaid coverage for abortion services, dismantle harmful policies like the 24-hour waiting period, and fund critical solutions to healthcare barriers like cost and transportation. And we can't rest until every person in our city has access to contraception and abortion, which are a key part of comprehensive health care. Because this is just not about healthcare. As it was just mentioned, it's about justice. It's about ensuring that no person is forced to risk their life, their future, or their dignity because they are denied essential care. The stakes are just too high for complacency. Together, we have the power to create a future where reproductive rights are protected, and not just as a privilege for some, but as a fundamental right for everyone. Thank you.
Thank you so much. And now we will hear from another member of the task force, a champion for reproductive freedom, and my colleague, Councilmember Rue Landau.
Good afternoon, everybody. Thank you so much for being here on this for this momentous occasion and for such an important reason. Thank you, Councilmember Brooks, for bringing us all together today. Your work in creating this task force has been instrumental in driving our collected effort forward. And thank you also to the work of former Councilmember Helen Gim, who was also pivotal in this fight, and Councilmember Jamie Gaudier. I also want to thank all of the speakers here today for lending their voices to this task force. In this job, I hear from constituents often about the issues that matter to them most. Housing, healthcare, taxes are all typical answers. But from young people, from young women, and from young queer people especially, we hear about reproductive freedom. And at the time of this particularly important election that is coming up, we are hearing about reproductive freedom a lot. We hear about the fear they have watching their rights stripped away in the news. We hear about their fears of the future. And access to safe, affordable reproductive health care is a human right. Yet time and time again, the federal government has put this right at risk, chipping away at our choices. I don't think it's an unreasonable statement to say every individual deserves the right to their own body and to govern what happens to their own body. I've been in this fight for a long time, working with ACT UP and WHAM, Women's Health Action and Mobilization. I fought against the restrictions we're talking about now, which sadly have become commonplace in the norm. It's something that we'd almost want back. These are things that I protested right after college, saying that any restrictions to reproductive health care in any way is too much, and that we are now at the most pivotal and scary time of watching our rights chipped away, knowing that the generations of most of the folks who are standing here, and certainly the generations to come, have fewer rights to their own bodies than we do now, or we did. And that, to me, is so frightening. It's criminal. It is absolutely something that we need to make sure that we are looking for the future for. And so thankfully so much that you guys are all willing to work on this task force and willing to make sure that we're keeping as safe a space as possible. Reproductive freedoms are most commonly thought of as protecting pregnancies and safe abortion rights, but these freedoms extend to the LGBTQ plus community too. And as the first openly LGBTQ council member, I take this very seriously. When we advocate for the rights of our own bodies, we are also advocating for trans and non-binary Philadelphians who need access to gender-affirming care. When we demand the freedom to our own bodies, we demand that fully across the range of how it may look. Reproductive health is not one-dimensional. It encompasses a spectrum of care, from pregnancy and abortion services to menstrual equity and reproductive autonomy. With this task force, we're starting a national conversation at the local level. We're listening to the same young constituents and lifting up their voices. Today is a big start to the conversation, and I, for one, am excited to get started. Thank you to all the task force members. Your voices, your work, and continuing this fight is essential for how we're going to move forward. Thank you.
Thank you so much, Councilmember Landau. And next, I'm very pleased to welcome another member of the task force and the founder of No More Secrets and The Spot, period, Lynette Medley.
Thank you, Councilmember Brooks. So menstrual equity means ensuring equal access to menstrual health and menstrual products and resources and those impacted by menstruation. And also the term means ensuring fairness in how menstruation is perceived by those directly and indirectly experiencing menstruation. Menstrual health care is a reproductive health issue. Comprehensive reproductive health care encompasses more than access to abortion, contraception, STI prevention. It also includes the right to access information and services related to uterine and menstrual care, which are critical for the overall well-being and autonomy of anyone who menstruates. We all know the experiences that we have had without having access to menstrual products. But then again, we might be looking through our own world lens and perspective and not understanding what's happening to our community members. They might have to stay in unhealthy relationships. They might have to steal. They might have to use unhealthy methodologies. They might have to use a product for over and over again, or they might have to engage in survival sex just to have access to menstrual products. Access to quality uterine and menstrual health care is essential for preventing and managing so many diseases and disorders. We have seen people with inherited blood disorder, hemophilia, people who have endometriosis, fibroids, polycystic ovarian syndrome, and either reproductive health issues. What about the person who had a pregnancy and it didn't go to term? After they leave, sometimes what do they need? Menstrual products. Did you know that physicians can write a prescription for someone to get menstrual products? Even if someone has a successful pregnancy, after they leave the hospital, they might bleed for days. Did you know that a physician cannot write a prescription for them to get those products? So they have to come to the community. They have to come to the spot to get those services. The stigma and the lack of education surrounding uterine and menstrual health can lead to inadequate care, misdiagnosis, and a lack of understanding about these conditions, which disproportionately affect Black, Indigenous, and other communities of color, which exacerbates existing health disparities and the social determinants of health that are affecting our communities. But there are differences in the approaches to elevating the burden of menstrual insecurities in our communities. We have a whole lot of people here who are part of this task force. They come from different avenues, different privileges, different lenses. But there are legislators, politicians, policies and procedure, advocates, activists, and community members. But then there are organizations like ours and so many that are action-oriented and delivering direct services to our community. For over 10 years, we've been at the forefront providing vital education, resources to empower our communities. So the funding that's been allocated is so essential for organizations like ours and critical for the continuation of services. Without our organization, and I'm gonna say ours, the spot period, yes I am, our communities will face catastrophic generational devastation, forcing individuals into high criminal behaviors just to meet their basic period care needs. Philadelphia must recognize the urgent need to fund organizations that have already built the blueprint, earned the community's trust, and are actively doing the work, increasing funding opportunities for these proven leaders for an essential and real lasting change. So I will ask you, have you ever had to go to work and sit in a puddle because you did not have access to a menstrual product? Have you ever had to sit through a meeting because you didn't have access to menstrual products? Have you ever not been able to go to school because you did not have access to menstrual products? What happens if you have a medical condition? What happens if you're just born with something like hemophilia or inherited blood disorder? It's not a socioeconomic issue, it's a medical condition. This task force is going to change things because we understand, we have lived experience, we have expertise, and it's time for change. Thank you.
Thank you so much, Lynette. When I think about reproductive freedom, I often think about my 4 daughters, and I worry that my youngest, who is in high school, actually has less freedom than I did at her age. So it's very important to me to include youth members on our task force. For our final speaker today, I would like to introduce you to one of the youngest members of the Reproductive Task Force, high school senior Eliza Cucchiera. Where's she at? Okay. Come on out, come on out.
Hello, everyone. Hi. I'm so excited to be here talking to you today. In 2017, when I was 10 years old, my mother took my sister and me to the Women's March in Washington, D.C. I remember that all of the women around me were wearing pink hats with ears, that my feet really hurt, and that my mom explained to me that the symbol on people's signs was an outline of a uterus. Being in that moment, where hundreds of thousands of women were united, inspired me to make change. When I reached middle school, that passion shifted to reproductive justice. Being a young activist is a uniquely frustrating experience. I want to make change in a world that I will have to live in, but it often feels like there are no clear paths for me to do so. I've only recently turned 18, so voting has never before been an option, but it definitely is this year. For so long, it felt like my only choice was to sit, cross my fingers, and watch other people make decisions about my generation's future. Spring of my freshman year of high school, it was leaked that there were threats to Roe v. Wade. This is a very scary thing to hear as a 15-year-old girl, and it turned out that I wasn't the only one that felt that way. When my friend and I decided that we wanted to try to make as big of an impact as we could, dozens of my peers wanted to be involved. We ended up organizing a school walkout in collaboration with other schools in Philadelphia and as part of a movement from schools all over the nation. More than half of my school walked out, and I spoke at Love Park. By my sophomore year, we no longer had the constitutional right to an abortion. I had kind of found my footing as an activist and organizer, so my friend and I founded a club at our school called the Reproductive Health Alliance. We spent the next 2 years fundraising and have raised thousands of dollars for organizations like the Abortion Liberation Fund and the National Network for Abortion Funds. Last year, we worked with No More Secrets and students from 10 other Philly schools to organize a menstrual product drive. We asked our communities for help and were able to collect 25,000 products for people in need. There are so many young people in Philadelphia and all over the country who are terrified to see our rights to reproductive freedom slipping away. Everyone deserves to have control over their body and over their life, and it is hard to understand why the right to choose is so controversial. People think that we are too young to have a say, but young people care about this issue, and we know what we're talking about. I am so honored to have the chance to speak up on behalf of my generation, and I am so excited to be on this task force with so many inspiring people. I hope that this is an opportunity to protect reproductive freedom in all forms, and I can't wait to do this work. Thank you so much.
Thank you so much, Eliza. And now we have a few moments from any questions from the press. So the vision it is a court is all of those things together. The purpose of the task force is to come together and set a course for what's next. So it's going to be legislation. It's going to be access to programming, but that is going to be determined by the members of the task force. That's why we're really excited to get started today and dig deep in. There's so many things that we can work on collectively, and I'm really excited to have pulled together this group of individuals to make that happen. Absolutely. We already realize that it's possible. So it's our responsibility to make sure that it does not happen here in Philadelphia. So our goal in this task force is not only just to set legislation, but also to be an example of how other jurisdictions can do the same because of that fear. Yes, I think we're planning to have quarterly meetings. I think that's the right number that we estimate around quarterly meetings to determine what the next steps are. Today is our initial meeting just in preparation for what's next. If the task force decides that we need to include more because what's coming up very soon, they'll make that determination. Yes, there will be a report that'll be available at the end. I mean, let's see what happens after Election Day. and it will determine how fast we need to move on producing a report and have movable outcomes. Any other questions? All right, well, thank you so much. And I look forward to kind of tapping back into the media and the body at whole to figure out what we're going to do next. And it's time for us to go dig in. Thank you so much.